Welcome to the Lake County General Health District Point of Dispensing, or POD training. My name is Dawn Cole, and I'm going to start you off with some general information about PODs. Let's dive in. A point of dispensing, or a POD, is a temporary site established to dispense medications, vaccines, or other medical supplies to a large population during a public health emergency. You may remember our public health PODs during COVID-19 that we had at schools, community centers, and service garages, among other locations. In essence, PODs function as rapid healthcare distribution centers in times of crisis. Medical countermeasures, or MCMs, are Federal Drug Administration regulated products such as biologics, drugs, and devices that may be used during a potential public health emergency stemming from a terrorist attack with a biological, chemical, or radiological nuclear material, or a naturally occurring emerging disease. MCMs can include biologic products such as vaccines, blood products, and antibodies, drugs such as antimicrobial or antiviral drugs, devices including diagnostic tests to identify threat agents, and personal protective equipment such as gloves, respirators, and ventilators. A local example of a device pod would be back several years ago when there was a pod to administer COVID-19 tests before Thanksgiving at the Lake County Fairgrounds. A public health emergency is a significant threat to the health of a community or population that requires immediate action and coordination from health authorities and government agencies. They can arise from many sources like infectious disease outbreaks, natural disasters, environmental hazards, and bioterrorism threats. So these last few slides comprise the conditions that would cause the activation and operation of a point of dispensing. To put it plainly, it's a situation where there has been a public health emergency presenting a threat to the public that can be avoided or lessened by the distribution of a medical countermeasure, whether that be a medication, vaccine, or device. And the place where the person will receive their medication or their medical countermeasure is a point of dispensing. We're going to talk about different pods in a moment, but all pods flow in a similar fashion. It starts with entering and receiving a greeting, and triage, which is often combined to be called griage. And this is where we make sure that those making use of the pod aren't already showing signs of disease or illness. And if they are, they're sent to a medical facility. After griage is forms distribution, where people complete their NAF form, which will be explained later. Then on to screening, to where forms are reviewed and a decision is made about the best medication or vaccine that the individual should receive. After that, the individual receives their medication or vaccine and information about that medication or vaccine and what to do if they have a reaction to what they received. Finally, they exit, which is also a place for any last-minute questions. You may hear public health staff talk about a push versus a pull method for medication distribution. Push method refers to going or delivering a medication to a population, which could be from door to door or using the postal service, as was done with the COVID-19 test kits in the past, or vaccinating homebound individuals at their residence. The pull method is setting up a pod at a central location and the people come to you. And this could be done using a walk-through pod or a drive-through pod where people drive through each of the stations and never have to leave their car. A closed pod may use one or both methods, or even a hybrid method in the case of a company or agency that has residents. There are many pros and cons of both walk-through and drive-through pods. Walk-through pods are more accessible because you don't need a car to participate, and you can distribute additional resources because you have a captive audience. But if you're dealing with a disease that's easily spread, it increases the chance to spread the disease to others, and a larger number of staff is needed to operate the pod. On the other hand, while it's easier to control the spread of infection for a drive-through pod, they require a greater traffic control, and the opportunity for pod goers to ask questions is also limited. So what are the different kinds of pods? Open pods are the ones that are operated by public health, other government officials, and registered volunteers. They're open to the general public. Closed pods are operated by private companies or organizations, and they're open only to that organization's employees, their families, and their clients. A closed pod has a memorandum of understanding with the local health department, as well as plans and procedures in place to fully operate their closed pod with little or no help from the health department. And we're very appreciative of our local companies and agencies that make the decision to become a closed pod, because if there's a widespread public health emergency and we need to distribute medical countermeasures to a very large group, the closed pods take stress off of our open pods, because that means that we have less individuals to serve. So if there's a public health emergency, should you call us immediately to find out when you're getting your medical countermeasures? Not necessarily. Before we would ask you to open your closed pod, we would receive guidance from the Ohio Department of Health and possibly the Centers for Disease Control and Prevention about what areas or groups of people are at risk, as well as who exactly we're permitted to give our MCMs to for distribution. As a closed pod, you have the freedom to choose who you will be providing medical countermeasures to. This could include your staff, their family, which could include neighbors or others who may not be able to get out, your residents and clients, their families, contractors, or interns. Once you have this number, it's easier to determine what your procedures will be to provide the medical countermeasures and what methods you will use, such as a walkthrough or a drive-through pod. Just a few considerations that should be part of your medical countermeasure plan. You should identify a delivery area where medical countermeasures will be stored. Normally, someone from your organization will pick up the medications or vaccines at a designated site and bring them back to your facility. Also, there should be a parking plan. Where will people park and how will they enter and exit your location? You'll also need signage so people know where they are going, and you may want to stagger pickup times just to make it easier, like everyone with names ending in A through C come at one time, and so on and so forth. So I'd like to thank you for your attention to this first part of the presentation. Jessica Wakely will now begin the second half of your closed pod training.
Thank you, Dawn. As Dawn said, my name is Jessica Wakely, and now that you have heard about pods, different models that you can use, and how they basically operate, we will shift and I will talk about how your closed pod would operate. As mentioned before, the decision to activate your closed pod for an emergency would depend largely on the specific incident and any guidance and eligibility criteria the health department receives from state and federal levels. If it is determined that your pod should be activated, the points of contact that you identify in your closed pod plan will be notified by the health department. The initial notification will happen by phone to ensure that the message is received, that your agency is briefed, and that you have the opportunity to ask any questions. After the initial activation, additional contact may occur by email to share situational updates and any materials, information, or documents that would be needed for the response. Once you receive this notification, you will begin whatever processes you establish to set up your pod and to notify the staff, family members, clients, and others what they would need to do to follow procedures to report to your pod. This can be whatever notification method you would typically use, whether that would be something like a call tree, an email blast, intercom system, or any other kind of internal notification systems that you might have in place. If your pod is open, the most likely scenario for that would be that a medication is being distributed versus vaccines. And in that case, one head of household can report on behalf of multiple people, which should help streamline your needs for traffic and line control at the pod. Once you've been notified to activate your closed pod and have been given instructions for when and where to pick up medications, you will need to begin preparing for your dispensing and distribution operations. This includes setting up the physical space that you've selected for people to come to your pod. The space you choose will need to be an open space and ideally should have at least 2 doors so that you can maintain separate entry and exit points to maintain and keeping the flow moving through your pod. On this slide, we've provided an example layout, which you can modify to fit the space that you choose. If you have regularly maintained your name, address, and personal history forms, or NAF forms, which we'll talk about shortly, and you have current versions of those on hand, a forms distribution and seating area to fill out forms could be minimized or eliminated entirely from the floor plan. Since you have a closed population, you could also conduct forms review and prepare orders for pickup ahead of time rather than having that happen real time during your pod operations if you'd prefer to do that. If you do this, you'll want to make sure that someone verifies that all the information is still current before providing the medications to people, since things like pregnancy status or allergies or things like that may have changed since the information was last collected. One of the main things to remember for your closed pod is that your staff, families, and clients that you have predefined may come to you to your closed pod for free medication. This is entirely voluntary and up to them whether they choose to take advantage of the service that you're providing. You may have some people who wish to go to an open pod or to consult with their own physician about the medication, and that's completely fine. They are covered in your allocation if they choose to take advantage of it. People should be made aware, though, that they should not get medication both from you and from another source. You might have situations where a person on one of your NAF forms may not be able to take either of the available medications because they have a condition or allergy that are contraindicated. In these situations, those people should be referred to a medical provider, either someone that you have on staff who can assess their situation, or they may choose to go to their own provider. And that should help them decide what medication is best for their specific situation. Because it might have changed, it's best, again, to review information such as allergies and pregnancy status before dispensing medication. If your closed pod is activated, the health department will provide you with several things to make sure that you can conduct your operation. The first is your allocation of medication, and those will come in the form of unit measured medication bottles or packets. You'll be provided with FAQs, or frequently asked questions, any emergency use authorizations and or fact sheets for the medications that you'll be dispensing. You'll also receive FAQs and fact sheets for the agent or disease itself for the specific situation that we're in, including information about things like exposure, signs and symptoms, time frames, etc. And if necessary, you would receive alternate screening forms and algorithms if the agent that is part of the current situation is not one that is treated by Cipro and doxycycline. Now we'll discuss some of the main roles that will need to be filled at your closed pod. The first and most important role is an overall point of contact and coordinator of operations. This would be the key person or people who are responsible for your closed pod. This person would serve as the key point of contact and main contact with the health department throughout the duration of the event. This role oversees and delegates all activities and functions that we'll discuss in the next few slides. The pod coordinator's role will include overseeing the pickup and delivery of medications to your location, taking and maintaining an inventory of medications, determining the location and functions that will happen during the pod operation, and dispensing the medications. This person will also be responsible for or delegate responsibility for security, whether that includes specific personnel or just finding a secure location for storage, arranging for people to maintain traffic or line control, and reporting back to the health department after dispensing operations return any leftover medication. This person will oversee everyone staffing the pod and make sure staff have everything that they need to perform their tasks. Screening and dispensing are the two main functions that will need to occur at the pod. You may choose to do the screening real time while your pod is operating, or you may choose to do it before you open the pod. The screening staff will need to review the screening forms and determine the appropriate medication for each person listed. The people in screening should be medically trained, as they will use the algorithm provided to determine the appropriate medications for individuals. This person should confirm that all information on the form is still correct if it was not collected very recently, for example, pregnancy status. This person may also dispense medications, or you may choose that you would do that as a separate step. Screening is often where things tend to bottleneck because of the time involved in reviewing the forms, so you will want to have more staff in this role. The person who dispenses the medication can provide the fact sheets and any pill crushing and dosing instructions as needed. If medically trained staff are limited, it's more important that you place them in screening rather than dispensing, since they will be making the decisions about which medications will be received. Inventory tracking is another important role. The person with this role should conduct inventory when the medications are first received and before pod operations begin, and then throughout the pod operations to make sure that you have an adequate supply, and then again at the end of dispensing to make sure that you know what you have left over. All medication dispensed should be documented, and there may be labels on the bottles themselves that can be removed and placed on the NAF forms to help with recording the lot and expiration for each bottle that's dispensed. This position helps make sure that there is enough medication to complete operations and that any extra is returned to the health department. Records of who received what medication should be maintained, as additional courses may be needed after the initial dose or in case of any adverse effects. This information also ensures that the health department maintains compliance with dispensing federal assets. Much of what you will need to operate your pod will be provided by the health department at the time of the event, and that would include the medications, documentation like the screening forms, if those are different from the NAF forms you already have on file, drug information sheets, emergency use authorizations, pill crushing, and dosing instructions. For your pod, you will also need to have signage to direct people to and through the pod stations, and it would be helpful to have things like pens, markers, and highlighters to assist in documenting what medications people receive. And of course, you'll need to have tables and chairs for your staff who are working at the stations. You may also wish to have other supplies that would be helpful to your staff, as well as food and drinks for your staff who will be working at the pod. Now, as promised, we'll take a closer look at the name, address, and personal history form. The name, address, and personal history form, also called the NAF or NAPH form, is a form that is used to collect the names, contact information, and health information for persons receiving prophylaxis through your closed pod. This is an example of a name, address, and personal history form that would be used for an event where Cipro and doxycycline would be the drugs dispensed. It contains screening questions to determine the type of medication each person should receive. These screening questions include things like allergies to doxycycline or tetracyclines, ciprofloxacin or quinolones, if the person is currently taking tizanidine or Xanaflex, which are types of muscle relaxers, if the person has myasthenia gravis, which is a chronic autoimmune disorder that causes fluctuating weakness in voluntary muscles affecting the eyes, face, and swallowing, if the person is currently pregnant or breastfeeding, and if the person weighs less than 76 pounds, which could indicate different needs for dosage or the need for liquid or crushing instructions to be provided. These instructions can also be provided if the person mentions that they have difficulty swallowing pills. One head of household can be designated to pick up medications for up to 20 people, which would require them to submit and complete 2 forms. It is important to reinforce to people that this isn't intended to be for family members within the household, close local family, assuming they have the same exposure, and those that they have responsibility to care for, like elderly neighbors or shut-ins, again, if they have the same exposure. Someone who is a close relative but located in a distant geography should not be included on the forms because, 1, they would probably not likely share the same exposure, and 2, the person would not be able to get medication to them quickly. They should go get it locally if something has happened in their area. If a person has multiple forms, their name should go on top of both forms, but only list their name once in the personal history section to avoid them being counted multiple times for medications. All questions must be completed for all individuals listed on the NAF form in order to determine what medication they should receive for their situation. An electronic version of the NAF form can auto-calculate the type of medication each person should get, and that can be either completed by the end user of the form or by the staff at the pod to cross-check the determinations they've made. Or, if paper forms are used, they can be reviewed manually with an algorithm such as the one on the screen to determine, based on their answers, which is the most appropriate medication for their situation. This concludes our training for today. We hope this information is helpful in preparing you for closed pod operations for your agency. If you have any questions, please have your closed pod point of contact reach out to the health department for assistance. We've provided our program contact information and specific contacts on this slide. We are here to assist you and answer any questions that you have at any time and support you in your ongoing planning, training, and exercising to help prepare for your closed pod. We will keep you informed of any changes on our end, and we ask that you let us know if there are any changes to your plans or contacts to ensure we know how best to reach your agency quickly and efficiently in case of an emergency. We look forward to our continued partnership with you and appreciate your being willing to take on this role to best serve all of our community. Thank you for joining us.